I'm Jeremy Bradley. I'm a pediatrician here at Twin City Medical Center, where I first met Jackson on his first day of life.
And he was born in Johnson City, September 30th, and they have probably 12 medical personnel around him, and we didn't know what was going on. And finally, one of the nurses turned around and said, "No, we're trying to intubate him because he can't breathe." I mean, Dr. Bradley was there, like the entire process. And he would step in and just talk to us just like we're talking now. Really made you feel more at ease. Really felt good because you really truly felt like he was on your side. And you could tell it was heartfelt and sincere. He was one of our biggest advocates, if you will.
Working with kids is the best. You just get to interact with them, you get to play with them. They bounce back pretty quickly from their illnesses, and you get to watch them grow from being a baby to going to school to making good grades and then on up and becoming an adult.
A nurse would come over and she would say, "Was that Dr. Bradley?" And we'd say, "Yeah." And she was like, "Oh, it's his day off." So that really truly meant a lot to know that he stopped by just to check on Jackson.
What we're lucky to have here is to be able to function as a medical home where we can provide just complete, comprehensive care. I think the families really appreciate that. You can come here and get the whole scope of the patient's life addressed.
I was deployed overseas, and she calls me like ecstatic. Just that initial connection with Dr. Bradley, really just immediately, we knew. Whenever she said that he's in Bristol, and I said, "Call and see if he's accepting patients."
My name is Dr. Gayle Bates. I'm a pediatrician at Twin City Medical Center. I think Southwest Virginia Community Health Systems has a lot to offer our patients in the area, and we have a really caring staff that works well together.
He came 3.5 weeks early on New Year's Eve, and I did not get to see him. He was put in an ambulance and sent to Knoxville immediately, and it was a very, very scary time. Before the age of 9 months old, he received about 40 surgeries. Once we got home at 10 months old, he would need to be seen by lots of specialists, but he needed a main doctor, a main primary doctor. We have a wonderful relationship with Dr. Bates and I. Whether it's a prescription refill, she orders all of his medical supplies and makes sure that they're in the right quantity. She's never let me down.
So there's so much rewarding about being a pediatrician. One of the things I love about it is that our patients are almost always upbeat and positive, even when they feel terrible. Because you can really tell that even if they don't feel well, that they still just want to get well and play and do normal kid stuff. And then for those kids who have more chronic illnesses, helping them navigate the system and navigate those medical needs while still finding time to be a normal kid is really rewarding.
He takes this better than any adult would. He's always laughing, he's always happy, he's always smiling. He's always grateful for life.